pressure platforms, a set of sensors are used to take measurements of the tread. These sensors can be used to take measurements in statics and in dynamics with a function of diagnosis or to evaluate the foot. These measurements can be taken in kilopascals or in grams per square centimeter. The professional asks the patient to take off his shoes and socks. To take the static measurement, the patient is asked to position himself in the center of the pressure platform, look straight ahead with his arms extended along the body, and walk without displacement. All this is done to achieve a physiological position of the individual and to avoid that the measurement is falsified. Once this is done, we will take the pressure measurement. The data is taken in the software of the computer connected to the pressure platform. For the static pressure measurement, we obtain a capture like a photo. Pressure data is obtained from both feet of the patient on a color scale that ranges from cooler colors, for example blue, to warmer colors like red. With our image taken from the patient in statics, we can observe where the points of greatest pressure are located in each foot and determine if they correspond to the pathology that the patient presents. For example, in metatarsalgia, where we will see greater pressure at metatarsal heads level. We will also highlight the presence or not of the finger pads, the greater or lesser presence of the isthmus, which can indicate the presence of flat foot if it is increased, and will allow us to identify if the patient's foot is more pronated or supinated, for example. We obtain in our static measurement the point of maximum pressure marked on each of the feet. In addition, we obtain the marking of the gravity center of our patient in statics. With the gravity center point, we can calculate the distance at which it is located respect of the axis of each leg. If the distance from the gravity center to the axis of each leg is different, it may lead us to suspect a dissymmetry, which we must corroborate through exploratory tests. The patient is asked to stand looking straight ahead with his arms extended along the body, and we can observe from the front and from the back if we have symmetry at all levels, like shoulder level, folds, iliac spines, and knees, and these possible symmetries could make us suspect of a dissymmetry at each level. To perform all this test, the patient is asked to lie in supine position face up on the stretcher. The professional places the patient's lower limbs with a 45-degree hip flexion and a 90-degree knee flexion. In this position, we will ask the patient to elevate his hips twice. We will see from this position if there is a difference in height at knee level. The test will be positive if there is evidence of difference in height, like this. This will indicate a shortening at tibial level in the lower knee compared to the other one. The test is positive if there is evidence of a difference in height between the two knees, indicating shorter tibial in the lower knee. We can also have a knee which is in a forward position respect to the other. In this case, we will have a larger femur bone compared to the other one. The test is positive if there is an evidence of an advanced position of one knee with respect to the other, indicating a shortening at femoral level in the knee located in the behind position. A real dissymmetry is when there is a structural difference in bone length between the two legs of the patient. It is generally considered that asymmetries with 1 cm of difference or more between one leg and the other are susceptible to generate pathology. Among the possible causes, we could mention congenital alterations, growth problems, traumatic processes such as fractures or accidents. An apparent asymmetry is when there is no structural difference in the bone length of the patient's legs, but it is due to problems in other structures, for example in muscular structures, that cause the appearance of a difference in length between the limbs. It is the most common type of dissymmetry. Among the possible causes, we could mention muscular imbalances, problems at spinal level, like scoliosis for example, problems at pelvis level with pelvic anteversion or retroversion or pelvic tilt, and we can also mention visceral dysfunctions for example. The lower limb telemetry is a standing X-ray that ranges from ankles to hips and allows us to measure bone length accurately. For dynamic pressure measurement, we will obtain a video, not a photo like in statics. So we will simply ask the patient to walk and put one foot or the other one on the platform as if she would be walking in the street. Anyway, the platform's software allows us to measure in multiple dynamic measurement options, which will be easier. We will simply ask the patient to walk and put one foot or the other on the platform, and it will be the platform software, the one that will tell us if it is the left foot or the right foot of our patient. In the case of the dynamic measurement, what we will obtain is a video of the foot pressures while the patient is walking. Therefore, we can see possible anomalies in the different phases of the step: initial contact, full charge, and takeoff. The program shows us the progression line of the step, which in normal conditions begins in the external area of the heel in the initial contact, moves forward to the central metatarsal heads in full charge, and ends in the first or second toe at takeoff. This line shows us the progression of the pressures along the step. If at some point the line varies a lot its position, it may inform us of a possible instability in our patient, for example.